Thank you, Dr. Amuna. Thanks for an excellent presentation. Long time I didn't come across this headache. It's a rare headache, as you said. Rarely we will see it every few years, like the hypnic headache, the ice cream headache. I'm not sure if I came across one of these two headache, but the numbler headache, I noticed that is so frequent. So frequent, I mean, I will see a couple of patients coming in the headache with a typical presentation. Do you see them that frequent, Muna?
Nubular headaches, usually I see them post surgery, neurosurgical cases or head trauma cases. So they will
Clear.
always say this one part, this spot, and they'll ask me
Yes.
to bring your finger, let me touch this, touch this. Definitely.
Which is typical. Totally agree. Totally
Yes,
agree.
yes.
So thanks for both of you. I will start the questions. I try to summarize all the questions. We have very interesting questions which is coming here. So let us start with Abu Bakr. Dr. Abu Bakr, you can unmute yourself. I have many questions asking what is MIDAS?
MIDAS is Migraine Inventory Disability Score. We use it for grading the severity of migraine. I mentioned it in my talk. So there are 5 components. How many days have you been absent from work due to headache? And how many days you've been working, but the work capacity was reduced by half due to headache? How many days you've been not able to work due to headache? How many days you've been working at home due to headache, but your work efficacy was reduced to half? And how many days you've been absent or you're not being able to go to social gathering from headache? Because we accumulate those and put it in one score. So the higher number, the more severe the cases. So that's an indirect way to see how the headache is impacting your life. You see many people coming to you telling, oh, doctor, I have headache every day, 90 days a month, 9 or 30 days a month, 90 days in the last 3 months. In fact, when you ask them about their disability, it's 0. So then you know there is some discrepancy.
Yeah, clear.
They have less headache, 10 headache days maybe in the last 3 months, but the MIDAS score is very high. So that tells me that though the headache is not too much, but it's causing them higher impact.
Clear. Second question, Abu Bakr, try to make it sharp, Abu Bakr. Do Emgality help menstrual migraine?
Well, it's not proven. I don't know about it, but we know that if you have more frequent, so with menstrual migraine, if you're having headache more than 5 or 6 days, which is the usual course of migraine or the menstruation, then you are entitled for Emgality, and it may help.
Clear. And one of the questions, it seems from one of the nurses, why do ladies get more headache or migraine pre or during their cycle?
Well, we know that there is hormonal fluctuation during their cycle, and that by itself may provoke the trigeminal autonomic center, and it provokes the headache. We know this for a fact. People who are taking oral contraceptive pill may be provoked to it as well. So hormonal fluctuation by itself is a risk factor for having migraine.
Dr. Amuna, a question. CBT and NOAC, we know that the guidelines is recommending for a warfarin or Clexane. Do we have any update about using non-vitamin K anticoagulant in CBT cases?
I know there's a study ongoing which is going to be released this year. So there is a study going on that. But having said that, we have been using it in cerebral venous thrombosis since quite some time now, and I had presented a poster in the International Strokes conference, which was in Turkey about 5 years back. So I mean, the personal experience is it works very well because the headache of INR and the headache of the patient coming back and forth to the hospital is all gone. But as for the study going on, I know that this is going to be released this year.
Clear. Clear. Another question, Mona. Normal pressure hydrocephalus and weight loss. There's a new data coming in this field. Are you aware about that?
Yes, yes, it does help. So people who have BIH or IIH, idiopathic intracranial hypertension, is associated with weight gain, and we do ask patients to reduce weight, which helps in reducing the intracranial pressure. Definitely.
Clear. Clear. Abu Bakr, regarding CGRP with pregnancy and breastfeeding, we know that CGRP has been in the market post-marketing almost 2 years now. Do we have any safety data with that?
Not to my knowledge, but as per guidelines, they are not recommending CGRP antagonists for pregnant ladies. But
So do you advise the lady not to take the medication if they are planning for a pregnancy?
yes, I advise them not to.
Okay. What I'm aware about in this area, that the molecules that CGRP doesn't cross the placenta, this from animal models, at least 3 months before, in the first 3 months of pregnancy. And so there's this safety issue for the first 3 months. So what I'm advising my patient is continue taking it. But if you found that by incident that you are pregnant, which is very common in our community, the lady, we don't have a planning for a pregnancy. So if she's pregnant, she can stop using the CGRP. How about you, Mona?
Actually, it is not in the label, so you cannot use it in pregnancy and breastfeeding. So, but as you said, I agree completely. It's a very big molecule, does not cross the placenta. So, scientifically speaking, yes, but as per the label, no.
Yes.
Having said that, I had a lady who was 49-year-old. I started her on CGRP antagonist. 49, she said, I'm not going to be pregnant. She came after 6 weeks telling me that she's pregnant, but she had abortion. So I'm not sure whether CGRP would make her more fertile or not.
Any major side effect from both speakers, Dr. Amuna and Abu Bakr, with CGRP from your practice?
Actually, they are wonder drugs, and what my patients tell me that this is magic. This is a magic medication.
I had one case of flu-like symptoms, and it was so severe for her that she was very worried, and she went to do COVID testing.
Okay.
And then I told her, no, those are the side effects of CGRP.
My patients, yeah. So I think, you know what, I have not seen any major side effects. We've treated hundreds now. But I think they do blog out and they do internet search and they find hair loss. And a lot of patients do come and tell me, oh, there was hair loss. I said, every lady has a hair loss, but it doesn't mean that the injection you're taking. So I personally have not seen any major side effects with Emgality. Definitely.
Neither me. Both CGRP that we have, I didn't see. Also, they are speaking about the constipation or site injection rash and the others. From my own experience, almost 2 years, both are doing great with less side effects.
Constipation.
Yes.
Yeah. Never Abu Bakr constipation in your patients?
No, never.
No. Muna?
No, constipation only with Imovig, Erenimab, not with Emgality. No.
Okay, nice. Before we ended, Abu Bakr and Muna, how long as a senior consultant neurologist you will keep your patients on Emgality? The study that we have, the two first which came, it's 6 months, then they put it for 2 years. How long and what make you to decide to stop the CGRP after 6 months or to continue for a longer time? We will start with Abu Bakr.
Yeah, usually in the beginning I was keeping the patients for 6 months. Then I give them a trial for stopping it, and I see them again in 3 months' time. But now I learn I keep them at least for 1 year. Then I can stop it. Number one, because if it's in DHA, I need to give more chance for other patients to have Emgality. If it's in private, usually the insurance will not approve it after 1 year. So you have to give them reasoning. And usually after 1 year, if it's in private, I stop it and monitor them for 3 months. If their headache comes back again, then I will restart it again. So I
Clear.
have them a reason.
Clear.
And
Muna?
DHA is more
Yeah.
free, but usually I give more chance for other patients. So even after 1 year, I try to stop it.
For me, for episodic migraines, usually 6 months. And most of the time, after 3, 4 months, once you have a headache free 2, 3 months, patients themselves will say, Doctor, can we stop it and see? And but once you stop it, around 3, 4 months, they'll be fine. But they again come back and they say, can we have the injection again? Chronic migraines, usually I give them for a year at least. They don't stop. They
Clear.
usually require it.
Okay, got it. Before we ended, one last question about cluster headache and emgality. It seems someone is reading about CGRP with a cluster headache. Any one of you used CGRP for cluster headache?
The
Yeah.
usual dose is 300 milligram, but I give the 240. I gave it to 3 patients and they were effective. One of them,
Episodic or chronic cluster, Abu Bakr?
in fact, in one of them, they improved in few hours. The
MashaAllah.
headache improved.
Muna, do you use
No,
cluster
yes.
CGRP?
So I've used it in episodic only. Chronic, it doesn't work. I've tried it in the chronic once. No way. Acute only in the first week. Within few days, once the cluster cycle has started, you need to start it. And as Abu Bakr said, we have only the 240, not the 300 as yet. So I usually give that initially with the steroids, and it's good result. But chronic clusters doesn't work.
Okay, we are reaching night 20. We exceed our time. I would like to thank Dr. Muna Takur from Al-Zahra Hospital, senior consultant neurologist in Dubai, and Dr. Abu Bakr, who's a senior neurologist from Dubai also, for their presentation. Would like to thank MCO and Lily for their organizing this meeting, and wish you a great night. See you soon, inshallah, with Neuro Series.
Thank you.
Thank you so much, Sohail. Thanks a lot.
Thanks.
Thank you.